Pregnancy has 3 semesters, each of which is marked by a specific fetal development. A pregnancy is considered at full term in 40 weeks. Each of the trimester has its own symptoms and differ in every person. First trimester. The first trimester is the most crucial for baby development. During this period, the baby body structure and organ system develop. Most miscarriage and birth defects occur during this period. Next, the second trimester. The second trimester of pregnancy is often called the golden period because many of the unpleasant effects of early pregnancy disappear. Moving on to the third trimester. In the third trimester, the increase in the size of your uterus, which expands from approximately 2 ounces before pregnancy to 2.5 pounds at the time of birth occurs. Generally, women usually develop several physiological changes that might not be experienced by non-pregnant women. For example, increased maternal fat and total body water, decreased plasma protein concentrations, especially albumin, increased maternal blood volume, cardiac output, blood flow to kidneys and uteroplacental unit, and decreased blood pressure. Even at rest, the heart rate, respiratory rate, and pulse pressure of pregnant women are higher than unpregnant women. The non-pregnant women. To identify any abnormality in physiological changes that occur in the body as a response to acute exercise during pregnancy compared to non-pregnancy, exercise testing should be done. Therefore, therapists can prescribe the most suitable according to height condition.
Moving on to the symptoms of pregnancy. Do bear in mind that symptoms are different for each individual. Now, these are the common early signs and symptoms of first trimester of pregnancy. First symptoms: nausea with or without vomiting, increased urination, fatigue, and food craving. For second trimester, pregnant women might having dental issue, nasal problem, dizziness, and leg cramp. Whereas for third trimester, they might having shortness of breath, heartburn, and spider bed.
Hi there, are you pregnant mom? Are you sure you have a healthy pregnancy? Don't worry, because today we are going to provide you with one statistic that can help you determine your health condition. Use a cyclothermometer, which is using a stationary device that can measure the amount of work done by pedaling in the bike. It is known as cardiopulmonary exercise testing or CPE.
The function of the test is to test the cardiovascular and respiratory systems, measure lung volumes at rest and throughout the exercise, as well as blood pressure and heart electrical activity. It is commonly used to test women in second and third trimester with symptom of shortness of breath. Now, let's take a look at the protocol for this exercise testing. Firstly, it will be a sub-maximal exercise with implementation of incremental tests in which the intensity will be increased by adding load at the pedal. It also uses modified bulky protocol at 70% maximum heart rate. The procedure for this exercise testing are: firstly, the physiotherapist will ask a short questionnaire on details on the age, level of physical activity, gestational age, weight, and height of the patient. The patient's heart rate reading before the exercise is taken from the oximeter. The physiotherapist will then measure the blood pressure of the patient right before the exercise. The patient will perform cycling until 70% of their maximum heart rate, which is calculated using Tanaka formula of 208 minus 0.7 times by their age. There will be 3 sets of cycling and a 3-minute recovery phase. Throughout the exercise, all cardiovascular changes are analyzed every minute from the monitor. The first set is cycling without load or resistance for 3 minutes. The second set is cycling with load or resistance for 3 minutes. The third set is cycling with increased load or resistance for 3 minutes. This patient is a healthy pregnant woman as there is no symptom of shortness of breath throughout the exercise. The patient then rests for 3 minutes and the heart rate reading is taken from the oximeter. Physiotherapist will measure the blood pressure of the patient 3 minutes after the exercise testing. Next patient will repeat the same process starting with the physiotherapist asking a short questionnaire on details of the patient. The patient's heart rate reading before the exercise is taken from the oximeter. The physiotherapist will then measure the blood pressure of the patient right before the exercise. There will be 3 sets of cycling and a 3-minute recovery phase. Throughout the exercise, all cardiovascular changes are analyzed every minute from the monitor. The first set is cycling without load or resistance for 3 minutes. There is no visible symptom of shortness of breath. Throughout the second set of cycling with load for 3 minutes, the patient started to develop symptom of shortness of breath. In the middle of third set of cycling, which is with increased load, the patient's breathing started to get worse. Therefore, the exercise is stopped. The findings for the second patient are there are larger increase of breathing frequency and heart rate. The risk of cardiopulmonary access testing are big ache, deep and side pain, as well as hip pain. The second patient needs to do an exercise to improve shortness of breath. One suggested exercise is labour breathing. Belly or abdominal breathing helps shortness of breath by practicing slow, deep, and relaxed breathing, and it is suitable for women in third trimester. Lie down comfortably with knees bent and upper body relaxed. The physiotherapist will cover the patient with a towel and ensure the patient is in a comfortable position. Place one hand on the chest and the other below the ribcage or over the belly so that you can feel the diaphragm movement while breathing in and breathing out. Breathe in slowly and steadily so that the abdomen rises fully while doing so, making the hand rise. Make sure the hand on the chest stays still and slowly exhale through pursed lips, but make sure the abdomen lowers down while doing so and the hand on the chest remains still. Think about first lifting your pelvic floor and then wrap the abdominals like you are gently tightening a corset around your torso.
In a nutshell, the needs of exercise testing is to identify underlying any abnormal condition, stratifying the risk of adverse pregnancy outcome. All of women who are pregnant without complication should be encouraged to participate in aerobic and strength conditioning exercise as a part of a healthy lifestyle during their pregnancy. The goal of this exercise should be to maintain fitness level throughout pregnancy without trying to reach peak fitness. Thank you.